So we just want to reassure our citizens that we're taking every precaution. We're being very proactive about this.
Well, you're hearing there that a measles case has been confirmed in North Texas. You just heard from Rockwall County Emergency Management Coordinator and how health officials are doing everything they can to now stop the spread.
This comes after more than 100 cases have been confirmed across the entire state. And you can see from this map here that we're trying to show you, most are in West Texas. And now one case is close to home. But officials are saying that the case in Rockwall County is unrelated to the others.
Yeah, so Bo Evans is in Rockwall County this morning with what officials are saying so far. And Bo, what do they know about this case?
Yeah, Madison, Carmen, good morning. Officials told CBS News Texas that the person who got sick is an adult and they had just returned from international travel. So not a part of that outbreak in West Texas. But the person started showing symptoms when they got back to North Texas and then had to be admitted to the hospital. Health officials say that this person got back to the U.S. on February 6th and had a fever, cough, and runny nose on the 11th. They were sick enough to need to go to the hospital just 2 days later. The good news is officials say they believe only 4 people, including first responders, were exposed to this person and have been instructed on how to quarantine. However, county officials want to be extra vigilant to limit the spread of measles from this case in light of what's happening in West Texas.
There's always a level of concern when you have a case of measles. I've been practicing emergency medicine for 20 years, and I've only seen 2 cases of measles in those 20 years. And so being that there's an outbreak in West Texas, we just need to be extra vigilant that we're not missing these cases, have they arise in our community.
Now, officials say the people that have been exposed to the person who's sick have not shown any symptoms, but they are concerned that they will start to see more cases pop up over the next coming weeks. In Rockwall County, Bo Evans, CBS News, Texas.
And Bo, we've seen how fast the number of cases has been growing. So far, 124 cases of measles has been confirmed in the outbreak, and that's just since last January, or late January, rather. The first measles death reported in West Texas has also been identified as a school-age child who was not vaccinated. This measles death is the first death in the entire country since 2015. Now, here in Texas, health officials say that they are seeing some severe cases with 18 hospitalizations. Measles is a highly contagious airborne virus and can cause that very spotted rash of red spots, fever, cough, and red watery eyes. Public health officials say that the best way to prevent getting sick is to be vaccinated with the measles, mumps, and rubella, or MMR vaccine.
So if you have questions surrounding the vaccine, the CDC has given us some guidelines that we'd like to pass along to you. The CDC is saying children 12 through 15 months old can actually get the first of the 2-dose vaccine. You're looking at 4 to 6-year-olds for the second dose now. So if your child was exposed, the physicians today recommend talking to your pediatrician within 72 hours. That child who died in West Texas was not vaccinated against measles. So we wanted to know, could there actually be a reason for any child to not get protected? We checked with Texas Health and Human Services, and there are 3 vaccine exemptions. 1, if a healthcare provider determines it's unsafe to get a certain vaccine. 2, if they are in the U.S. military or if they have a religious or personal belief that goes against getting the vaccine. Students can actually request these exemptions at their school or even their college. So stay with us as we keep track of measles cases across our state and here in North Texas. We're on top of all the latest developments for you, and you can find those updates on CBS News Texas on air and online.